Do no harm. Those three words are loaded with a level of integrity that we all hope to live out in our professional practice. The latest census said that 27.3% of the people in the Birmingham area live below the poverty level. That means that with a population of just over 1 million people, there are more than 270,000 who cannot afford the kind of health care that you and I will not only expect to receive, but also want to provide. As medical professionals, we will provide a very valuable service to our communities, but we must remember that our values as human beings is judged by what we give, not what we get. Our patients do not care how much you know until they know how much you care.
You know, people hear 9,000 uninsured patients, and it becomes such a big number they forget about the one. They don't realize that's a kid who's lost 50 pounds, has no insurance. We worry that he has multiple sclerosis and find a way to get him an MRI so we can say, hey, you're going to be all right. You know, people lose that in that giant number. The face of those who struggle isn't just the guy pushing the shopping cart, and that guy matters, but we have families coming to us, dads who want to work, who can't because their back is out, or dads who want to work but their blood pressure's through the roof and they can no longer drive a truck, and they stand there with their little child and they say thank you. And they said, you know what, I'm never going to another doctor. You value me, you value my family. That's what gets us up in the morning. We're really entering a new stage. For a few years we've had to do projects just to earn the right to be heard, and we're going to continue to do those projects. But what we're seeing now is the opportunity for people to come alongside and not have things done for them, but to do things with them, to see projects become a together activity that's changing the community. We have all kinds of opportunities. One of the great things we're going to be able to do is open a travel vaccine clinic at Christ Health Center, kind of like your Tom Shoes. We're going to be able to say, you're going on a mission trip. How about that money you're going to pay to get your yellow fever vaccine? We'll use the proceeds from that to pay for those who don't have health insurance to have basic primary care. You'll do good as you travel, and you'll do good right here at home.
So each of us should try to help someone else on a daily basis. Instead of production and collection, give of yourself and your talents to someone unexpectedly. In other words, pass out the extra you have been given, the extra talent, the extra time, the extra skill, and the extra supplies. What you will find is that you cannot give goodness or good deeds away without them returning to you multiplied. Our opportunity has never been greater. Our responsibility has never been so clear. Our commitment to care for all people has never been so urgently needed. Most of you will agree that there has been a rather dangerous trend in our society, a trend of pleasure without conscience, wealth without work, business without morality, politics without principle, and worship without sacrifice. As we enjoy all the privileges, all of the opportunities, and all of the freedoms that are ours as citizens of this great country, we sometimes forget that every privilege has a responsibility, that every opportunity has an obligation, that every possession has a duty, and that freedom has been paid for with a heavy price. Remember that service we render is the rent we pay for the space we occupy, so we must do more. Sure, we must do no harm. We all know that. But we also must remember to care for those whom harm has already found.